Between 500,000 and 2 million people in the U.S. today are affected by Crohn's disease and ulcerative colitis, chronic conditions that are known as inflammatory bowel disease or IBD. Close to 140,000 of these patients are children and adolescents under the age of 18. A difficult disease at any age, IBD is usually not life-threatening, but can drastically affect the quality of a young person's life.
The inflammatory bowel diseases are a group of disorders, including Crohn's disease and ulcerative colitis. Ulcerative colitis is an inflammatory condition involving the colon and, in particular, the lining of the large intestine. In contrast, Crohn's disease can involve any part of the intestine from the mouth to the anus and includes the whole thickness of the bowel wall. This disease can occur at any age in males and females, but most commonly occurs in the ages of 15 to 25 years.
Although IBD's cause is unknown, it has been found that children with the condition have abnormalities of the immune system.
We do know that genetic alterations predispose people to get either ulcerative colitis or Crohn's disease, but that other events are required for the diseases to become apparent. The events that could be involved are infection or environmental exposures, but we need more research to identify precisely which ones are more important.
Studies also suggest an inherited pattern with a more than 20% risk of having the disease passed down. The stress of living with IBD, especially for younger patients, can worsen symptoms which include abdominal pain, excessive and bloody diarrhea, weight loss, fatigue, and loss of appetite. And while IBD cannot be cured, it can be managed. In the past, surgery was usually the first option in treating IBD. But today, the most common treatment involves medication aimed at controlling inflammation through the use of steroids when flare-ups occur, as well as antibiotics, immune modulators, and biologic agents.
An exciting development in the treatment of children with inflammatory bowel disease has been the addition of new drugs that we can use in their treatment. These new drugs allow us to avoid surgery for some children, postpone surgery for others. When surgery is required, typically the children are in better health, allowing smaller incisions and better outcomes.
For the most severe cases of pediatric IBD, surgery is sometimes required to treat complications and alleviate symptoms. Traditional surgery for IBD can be highly invasive, resulting in painful and longer recovery time, risk of infection, and scarring. But a revolution in the surgical management of IBD, involving minimally invasive surgery, is offering new hope to children and patients of all ages suffering from the condition.
Inflammatory bowel disease involves both the large and the small intestine. The advantage of minimally invasive surgical techniques is that it allows us access to the belly cavity without making a large incision. This results in less postoperative pain, faster recovery, and minimal scarring.
Heather Zartler, now 12 years old, was diagnosed with Crohn's disease in 2003.
The symptoms were diarrhea and weight loss. She didn't complain about any pain. She had a sore throat, went to the doctor, I mentioned some symptoms. She hadn't been gaining weight for about a year and a half, and I noticed she wasn't changing clothing or shoe sizes. So a blood test indicated a high SED rate, which meant an infection was present, and that was followed up with a UGI and a colonoscopy, which confirmed her Crohn's.
St. Christopher's Hospital for Children in Philadelphia is at the forefront of providing state-of-the-art care aimed at helping IBD patients achieve a better life through their minimally invasive surgery program.
Inflammatory bowel disease has a negative impact on children's self-esteem and body image. Adding a significant incision to this as a result of surgical procedure further adds to the burden of their self-esteem. The advantage of minimally invasive surgery is you avoid that scarring.
My husband and my expectations today after surgery would be definitely that she's in remission for quite a few years, pain-free, no diarrhea, that she has a chance to gain weight and grow in height. She's very hopeful that she can get on some roller coaster rides, and it's uphill from here.
St. Christopher's is not only committed to treating children with IBD, but also finding a cure for the disease. Led by Dr. Marshall Schwartz, It is hoped that clinical research conducted at the hospital will lead to groundbreaking advances in the treatment of IBD.
I believe that we are closer to and curing the process of inflammatory bowel disease by using substances referred to as growth factors, which we have in our own research shown to dramatically increase the inflammatory process in this animal model of inflammatory bowel disease. Therefore, we believe that this will be used clinically to treat and perhaps cure inflammatory bowel disease.
Named one of the best pediatric hospitals in the nation 3 years in a row by U.S. News & World Report, St. Christopher's focuses on making each and every child's experience better. They call it the Spirit of St. Christopher's.
The Spirit of St. Christopher's is about a passion for children and teamwork. A team of doctors, nurses, social workers, whomever is needed to meet not only the physical needs of the child and the family, but all of their needs. St. Christopher's is large enough to provide high-quality tertiary care, but small enough to customize and personalize that care. The care that only a family and the child can describe as the Spirit of St. Christopher's.
Since 1875, St. Christopher's Hospital for Children has been a leader in pediatric care, treating virtually every pediatric medical and surgical condition. With a dedicated staff of more than 270 medical and surgical specialists, including one of the most accomplished minimally invasive surgery programs in the U.S., St. Christopher's has cared for the children of Greater Philadelphia and the world.
St. Christopher's has been providing over 130 years of pediatric care. As one of the first pediatric hospitals, our physicians have been leaders in their field, not only as providers, but as teachers and researchers. Today, we continue our legacy of providing high-quality care, as well as research and teaching. We also continue to add new services and programs and technology to improve the health care of our children, because we believe in a perfect world, all children are healthy.
St. Christopher's Hospital for Children is working for a perfect world. To find out more, contact them today or visit stchristophershospital.com.